In the 2025 operating budget, which we brought last year, the board agreed to invest in us to do a study, to bring a consultant in and develop a roadmap for us to be building those capabilities and start to scale up use of technology across the organization to realize these efficiencies. That consultant was T1 and T2 Consulting, which is led by Dr. Kyle Wilson, who is our presenter today. So I'm going to invite him up to speak, and he'll present the report he's done. And the motion we have before the board today is to support in principle the recommendation of this report and direct us to come back next month when we bring the budget with a proposal of how we'll try and make some of these recommendations.
Dr. Urging, is the recording started? Okay. Welcome, Dr. Kyle Wilson. So we'll let you start your presentation.
Very excited to be here today. Over the last 3 or 4 months, I've been working with the agency around the IT digital strategy for the next 3 to 5 years, and I'll be walking through what we found in this presentation. So why now? When we take a look at this being a turning point for public health and IT, it was heard multiple times around legacy systems at the agency. Legacy systems, there's a variety of issues running legacy technology, some of which I'll go into detail in this presentation, some of which is touched upon in the next point in terms of cybersecurity. But in terms of a refresh of systems or a modernization of systems is beneficial for a variety of aspects, which we'll touch upon in the coming minutes. Managing cybersecurity concerns. There's certainly, we've seen in the public sector, we've seen in the private sector a lot of information around cybersecurity, the cost of cybersecurity. I think of the Hamilton example is sort of most recent in terms of 18 million plus at this point with the denial of the insurance. So the burden is large if one of these events is successful. And the whole idea is to minimize the probability of a successful ransomware event in the agency. Staff burnout and operational efficiencies, heard from multiple staff around manual processes and just the inefficient processes. So as spoke about earlier in terms of the ISPA project that you embarked on, there's areas of improvement like that across the agency that allows for automation of processes and reduction of manual tasks. And then instead of doing those manual tasks, those staff members could do higher order activities with their time. Strategic readiness. One thing I heard throughout the engagements, throughout the interview process, certainly people are interested in change, especially if it's those individuals that are performing the manual tasks in question. So in terms of now being the time, certainly I think now is the time, the appetite is there for this strategic change in direction. And smart investment of sustainable savings. So during this presentation, I'll talk a lot about wave 1. There's 3 waves to this process: wave 1, wave 2, wave 3. Wave 1 being the first wave, which is really looking at strategic investments to ensure long-term operational efficiencies at the agency. By that, I mean wave 1 having some cost associated with it, but then wave 2 and wave 3, you're starting to realize cost savings because of those investments in that preliminary stage. When we look at overall the strategy, we're looking to certainly empower staff, giving them the tools they expect, that they want to do their day-to-day work. The sort of staff of the future, when you take a look at hiring processes and bringing new staff on board, they're certainly looking at organizations that have the tools in place, that have the systems in place that they expect to do their day-to-day work. The data-driven decision making. When we think of data, you think of having access to the information that you need to make your evidence-based decision making. I think of having clean, structured, centralized data that can be pulled upon by the entire organization in an automated fashion. So there's no need to ask someone for a report, no need to ask someone for information. The whole organization will have at their fingertips these customized dashboards or customized reporting that's fully automated. And that can help in the day-to-day without any manual intervention from colleagues that they have to ask for the information. Risk reduction. I will probably repeat this a few times in terms of risk reduction and cybersecurity. This one's big. So the minimization of the probability of a successful attack is key, and ensuring that your systems, your security systems, are hardened to the best of our abilities is important right now, and certainly important moving forward. I think I had a meeting with the head of the cybersecurity division of the RCMP, and she was mentioning in terms of the cost of cyber, or the cost of ransomware, being the third largest in the world. It'd be sort of equated to a GDP behind the US and behind China. So sort of that business is enormous. It is huge. And certainly in the next sort of 5 to 10, it will become bigger. And there's even services out there where people that don't understand how to do these cyber attacks will use cyber as a service, almost like software as a service, and then pay others to do the hard stuff for them, to potentially do more attacks across various agencies. And of course, designed in digital equity. So the systems and services looking to be inclusive by design. I think we do privacy impact assessments, equity impact assessments should be done throughout all the projects as we do our deployment. Wave 1, Wave 2, Wave 3. So I spoke of the 3 phases to this project. Wave 1, really looking at foundational changes. I'll touch upon some of the projects in a moment, but looking at cloud migrations, there's certainly some security or cybersecurity projects within that realm. It's really taking a look at how do we lay the foundation for the next 2 waves to come. And then in Wave 2, looking at systems integration and governance, aligning various platforms, establishing the data governance council or committee, really ensuring that information is able to be shared on an automated process and shared in a very easy manner for all of our constituents, all of our board members, all of our staff members. And then innovation and equity driven tools. This isn't saying that AI and innovation isn't happening from day one in terms of in Wave 1 and Wave 2, but I see there being a strong tie, a strong push in Wave 3 to really look at how do we innovate now that we have this strong foundation in place. The governance is fully in place for the agency in terms of how to do this in an appropriate, responsible manner to really take it to the next level, to innovate the services with the end goal to become more cost efficient. Trying to make the best use of public sector dollars as possible. I mentioned in Wave 1, there was a few initiatives. I talked about some of them here. The cloud migration, so transitioning to SharePoint Online to enhance security, scalability of document management, and sharing of resources. The Governance Council launch, establishing an oversight strategic alignment across IT, and the entire organization to ensure that these projects are being deployed in the sort of best, most responsible manner possible. Cybersecurity playbook, certainly deploy proactive framework, mitigation of risks, perhaps do tabletop exercises. One thing that I've seen successful in the past is we'll have someone come in, and there's provincial bodies that'll do this in kind, and they'll sit down with board members or senior leadership and then do a tabletop exercise where it's, okay, they'll usually play videos and this just happened. It's 9 a.m. on a Monday morning. What do you do next? And then it goes out to the table, and it's actually a mock real world scenario to get people prepared for the what if something were to happen. AI pilot, there's certainly out of the box AI solutions out there that are low risk, easy to implement, and pretty cost efficient. That could allow for, again, automation of tasks and allowing to minimize some of the manual processes. Digital skills and literacy program, we talked about an LMS or a learning management solution to be able to provide all the information to staff and board members around the technology being used and how to best use the technology as it's being deployed. And then an internal service intake portal, which we talk about ticket or the internal ticketing system in terms of an expansion so that it can be leveraged the best way possible. Benefits, enhanced collaboration tools. We talked about Microsoft Teams or SharePoint Online to be able to improve the communication across the organization. stronger security posture in terms of hardening the network and increasing the cybersecurity posture of the agency, being a good thing longer term as ransomware has become more and more common. Reduced administrative burden with the AI-driven tools and the automations implemented. We should be able to see lower number of manual tasks and a lower administrative burden across the agency. Targeted staff training, especially for those that need perhaps an extra bit of support through that learning management solution. We took a look at wave 1, wave 2, wave 3, and really balanced the approach to ensure that it was achievable within the timeline. So we didn't want to put too much into wave 1 and have some type of burnout or just perhaps too many projects on the go. So to ensure that it's equitable across 3 waves so that staff see it manageable. In terms of mandated outcomes, so the accelerated, we think of outbreak responses. So we certainly could have an accelerated outbreak response. Improved data infrastructure enables this real-time case tracking, faster alerts, more efficient contact tracing. The streamlined immunization workflows goes hand in hand with the ISPA presentation that we just talked about earlier, where you can have you're talking about automated letter creation and automated data flow within the ISPA reporting process. Better access for rural areas and remote teams to be able to have these platforms that can be connected to and used across the region. And alignment with our health equity priorities. The digital system certainly designed to be flexible, inclusive, and support the health equity mandate. A taste of some of the costing around these projects. And again, I think of wave 1 having some one-time costing associated with it for the next for 2026 or the next year, and then these projects being able to be leveraged to then have cost efficiencies across the organization to be able to repurpose those dollars to support the teams. SharePoint migration within the $25,000 to $40,000 range. Teams rooms upgrade, again, similar range. Service management platform, the sort of centralized unification of all systems. We talk about an ERP, an enterprise resource planning solution, or an EMR, an electronic medical record system, or all the other various systems at the agency that they can talk to each other in an automated way. The AI pilot, talked about a bit in terms of in wave 1 to do a quick win around AI pilots, and then staffing. A couple options for staffing, but having dedicated contract staffing over the next within 2026 to be able to support the initiatives. The resource options, I should highlight that this is 2026 dollars. So the contract positions being a 12-month placement would be the recommendation. No permanent hires, no change in permanent budget for permanent dollars. And really focusing on capacity, not scale. So resourcing aims to stabilize service delivery, accelerate the adoption of the AI automation leveraging technology over the next 12 months to really grab the lessons learned and really use the technology best way possible so that in wave 2 and wave 3, we start to see those benefits. And you may recognize the 4 pillars. We may see the 4 pillars on the wall in terms of the IT strategy being in line with what's already being done here at the agency, supporting certainly equal opportunities for help, digital equity being a core design principle within that, impactful relationships, the wave 1 focusing on collaborative tools and how are they going to be leveraged to ensure that we have impactful relationships across the district. Excellence in public health. I talked about evidence-based decision-making and information at your fingertips with customized data dashboards, certainly helping in that area. And having a healthy, resilient workforce with the learning management solution and better understanding technology and how to best leverage it in their day-to-day. Back to the public health standards, certainly in line and helps with foundational standards, with it being more corporate admin services standards within foundational, but also for emergency preparedness, it's something else, another COVID, knock on wood, or another type of situation were to occur, that having these already in place would be quite beneficial. And I already talked a bit about communal disease control in the previous slide, and certainly health equity. A lot of people think of the risks. Is it risky to go down this route? I like to also think of that there's a risk to not go down this route. So sometimes the risk of not doing something is greater than the risk of doing something. We think of cybersecurity breach risk. The risk of not doing something, I would argue, is quite substantial compared to doing something around cyber risk. Burnout of staff, lost funding around innovation. There's a big push right now around a lot of these initiatives, and partnering with federal, provincial, post-secondary institutions with available grants and funding. And certainly now is the time. Escalating costs over time, because with inflation, things are getting more expensive. So doing it earlier than later certainly being important. And the momentum loss that I talked earlier about, sort of the engagement and the excitement to start now, certainly there. You've probably seen these three items. This is out of the board motion or the briefing note around, we're looking for a strategic roadmap endorsement, that the board endorse the recommendations within the strategy, endorse the wave one investment priority areas to set up for these one-time costs in 2026, support long-term efficient growth, and the medical office of health budget direction as the last one. With that, I'll open it up to questions.
Thank you, Dr. Fong, for your presentation and detailed report. So I'll ask board members if there's any questions related to the presentation regarding the IT strategy. Go ahead, Angela.
I will always caution around data mining when it comes to Indigenous relationships. So I don't know where we're at with this when it comes to this strategy, but I trust that your leadership within public health through Kathy Dokes, we have not had a positive relationship when it comes to extracting data from our Citizens Plus, and it's never been a positive outcome. So I will caution how we extract that data if we're engaging. I'm not saying not do it, but I think that you need to tread very lightly on how you're going to achieve that.
Chair, I very much agree with that. So we very much recognize that if we are doing analysis or collecting data on Indigenous persons and identifying it as such, it must be done in partnership with them having a say in how that data is then used. Kathy Dokes is currently leading a project to bring Indigenous data sovereignty in place into the organization to help govern how that is going to move forward. And that will be done in parallel to this work and would be a precursor to us really using any of that data moving forward. Where that work stands right now is we are seeking the market for quotes for a consultant who has expertise here, who is Indigenous in background, to come in and give us advice on that.
Perfect. Thank you much. I appreciate that.
Thank you for the question. Any other questions from board members? I don't, Rochelle, is there anyone online that has it? Go ahead.
Just a comment. Thank you for the presentation. Presumably there's been a business case done prior to all this to justify it. But to reinforce that, I think it may at some point be worthwhile if this gets challenged for anybody is to your point, list those unwanted events that would be associated with not doing this. And you could very easily come up with a risk profile. And I think that would add a lot of rigor to any kind of business case that we're putting forth to support this.
Yeah, and I agree with that, Bob. It's we've seen other agencies, organizations that chose not to save a little bit and ended up costing them more because all their data was wiped out and they have to start from square one. So and the cost, that's private information. They don't want to share it publicly. So it's not just the monetary cost, but it's also the people cost and the information that's out there that individuals don't want their information being shared. So any other questions or comments? Thank you, Dr. Al, for the presentation and that information.